All right, so good day everyone. Today we are going to discuss about depression. Before we formally start, I would like to thank our um, professor, Mr. Emmanuel de la Cruz. Without him, this panel discussion wouldn't be possible. So yeah, before we start, I would like to formally introduce myself first. I am Niko S Dolar, and I will be your moderator for today's discussion. Please welcome our panelists for today's discussion. Um, Let us have Miss Samantha Nicole Aniga, Miss Jewels Bigalbal, Miss Christine Gallego, and Miss Margaret Eian Mendoza. Okay, so what is really depression? So our flow of our discussion for today's the discussion outline, introduction and brief history, linked genes and chromosome, diagnostic criteria, case study, treatments, and preventions. So before we start or before I ask our panelists, I would just like to give you a brief introduction what is depression. So everyone experiences sadness and happiness at the same point in their lives. These feelings of sadness or lost interest in activities you once enjoyed can lead to a variety of emotional and physical problems such as depression. Depression is a common and serious medical condition that is also treatable. Now, however, the more intense and the longer of duration than typical sadness or grief leads to what we call as clinical depression. And it interferes with illness that negatively affects how you feel, the way you think, and how you act. So, brief history. During the 19th century, German psychiatrist Emil Kraepelin mentioned the term depression as melancholia, or what we call as the depressive states. He then ascribed it into two branches, which is the manic depression and dementia precox. The manic depression that we all do now today is what we call as the bipolar disorder, and the dementia is what we call now as the schizophrenia. Okay, throughout the human history, long before current definition for major depression or major depression disorder treatment, the concept of depression has been repeatedly molded and reconceived major depression, or what we know as the MDD. Now, the person diagnosed with major depression will experience previously symptoms that can either occur repeatedly, called episodic, or it can either be a chronic, it lasts long, or it regain from time to time. Okay, so it's typically severe and it can only happen at once. It's up to that person how he or she can recover, right? So, Ayan. So I think we mentioned our depression, our topic for today, and I would just like to ask our panelists. How are you, panelists? Right. I think you're all good. So this is a very intriguing question. No? Is there any connection between the genetics and the depression? Sige, let us have Miss Samantha. Go ahead.
Hello, thank you so much for that question. Actually, that is really intriguing, no? There were study actually that confirming that depression is always almost genetic. So according to Sullivan et al., on their study entitled Genetic Epidemiology of Major Depression Review and Meta-Analysis, the major depressive disorder is partly heritable. According to the meta-analysis that they have conducted, they have estimated the heritability of MDD around 37%. Next slide, please. Okay. The heritability of estimate might be as high of 66% measurable error due to unreliable taken into consideration by evaluating MDD twice, and that is according to Fulay. And according to the family twin adoption study, genetic factors have major influence in the development of the MDD. As per of the twin study, MDD has heritability of 40% to 50%. And the family studies shown twofold to threefold increase of lifetime risk among first-degree relatives. So from this finding, many researchers prompted to look for the genes that influence MDD vulnerability, and that lead us to these three conclusions. Okay, next slide, please. So first one is the chromosome 17, the serotonin transporter gene. So serotonin, also known as 5 hydro 5 hydros 5-hydroxytryptamine or 5-HT is a naturally occurring trans neurotransmitter that carries signal between nerve cells all over our body. And the human 5-HT gene is localized in our chromosome 17. So the serotonin, it aids in the mood regulation and memory in our brain, but it also have role in different parts of our body. So, but we just need to focus on brain because we are dealing with depression, diba? So serotonin deficiency has been linked to depressed feelings, sadness, and fatigue. However, too much serotonin, on the other hand, can cause also negative effects such as serotonin syndrome, which can lead to the symptoms of restlessness, hallucination, and confusion. So that our first one, the chromosome 17. Next one is the chromosome 3p2526. So this is a chromosome 3. So this is the research lead by King's College of London. They have discovered the first solid evidence that the genetic variation on our chromosome 3 may cause depression. So the study, it has took 10 years actually for the Depression Network project of over 800 families with recurrent depression. And according to the study, when the diagnosis were filtered by severity, which has a maximum LOD of 4.4 centered at the linkage marker of D3S1515, the researcher discovered a genome-wide subtaneal linkage to the chromosome 3p2526. And from that, they have found robust evidence that a region called chromosome 3p2526 is strongly linked to the disorder. That is the second one, the chromosome 3p2526. And the last one is like our telomere. Okay, telomere, according to the National Human Genome Research Institute, this is the region of a repetitive DNA sequence on our DNA found at the end of our chromosomes. So as per the study conducted, short telomere linked to vulnerability to depression. This is concluded because the researcher conducted a study with 97 girls participants at age of 10 to 14 years old. Half of those girls are from the parents or mother with history of depression, and the other half is from mothers who don't have history of depression. And they have taken saliva DNA sample, and that they concluded, or the result of that saliva DNA sample, that those girls from mother with history of depression have shorter telomere than those with no history of depression. Another thing is that the girls with moms with depression or history of depression have recorded high level of cortisol, which is our stress hormone. So to answer that question, to conclude that yes, depression is linked to genetics, and that will lead us to the three conclusion: chromosome 17, chromosome 3p25, and the telomere in our chromosome.
Wow, that was a very informative and very scientific approach coming from Miss Samantha. So I also have a follow-up questions with our panelists. This is the common thing that is always asked by a lot of people. What are the signs and symptoms actually of a person having a depression? Okay, let's have Miss Margaret. Go ahead.
There are actually several signs and symptoms of a major depressive disorder or clinical depression. So this set of signs and symptoms is called the diagnostic criteria. This is used to determine the cause or the nature of the major depressive disorder according to the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5 by American Psychiatric Association. So this, can you please turn to the next slide? So this the diagnostic criteria of a major depressive disorder is divided into 5 criteria: criteria A, criteria B, C, D, and E. So Under the criteria A, these are the essential features or the symptoms of a major depressive episode during a 2 week period. So in criteria A, the first symptom is depressed mood most of the day. So a person with a major depressive episode experience the feeling of sadness, emptiness, and hopelessness. And aside from depressed mood, for some children and adolescents, they can develop or they can experience irritable mood. So in criteria A2, markedly diminished interest or pleasure in all or almost all activities. So individuals may report feeling less interested in hobbies or not feeling enjoyment in activities that were previously considered pleasurable. So for example, a child who used to enjoy soccer finds excuses not to practice. So aside from that, in some individuals, there is a significant reduction from previous levels of sexual interest or desire. In criteria A3, significant weight loss when not dieting or weight gain. So there's a change in appetite that may involve either a reduction or increase. So they might have a change of more than 5% of body weight in a month. So another symptom is insomnia or hypersomnia nearly every day. So a depressed person may experience sleep disturbance that may take the form of either difficulty in sleeping or also called as insomnia or sleeping excessively or also known as hypersomnia. So sometimes it is the reason that the individual seeks treatment because of disturbed sleep. So next symptom is the criteria A5, psychomotor agitation or retardation nearly every day. So when we say agitation, it is the inability to sit still or inability to walk properly, hand wringing, or the very common symptom is rubbing of the skin, clothing, or other objects. When we say retardation, it refers to slowed speech, thinking, and body movement. So the psychomotor agitation or retardation must be or can be severe enough to observable by other and not represent merely by objective feelings. So the next criteria is fatigue or loss of energy nearly every day. So a person may report sustained fatigue without physical exertion. So even the smallest tasks seem to require substantial effort. So for example, an individual may complain that washing and dressing in the morning are exhausting. So that is fatigue or loss of energy. So the next one is feeling of worthlessness or excessive or inappropriate guilt. So the sense of worthlessness or guilt associated with major depressive episode may include unrealistic negative evaluation of one's worth or guilty preoccupations or ruminations over minor past feelings. So for example, blaming oneself for being sick and for failing to meet occupational or interpersonal responsibilities. So that's the criteria A7. So in criteria A8, diminished ability to think or concentrate or indecisiveness nearly every day. So they may appear easily distracted or complain of memory difficulties. They are unable to function while in some children, a precipitous drop in grades may reflect due to poor concentration. So that's the effect or that's a symptom of a major depressive episode. So the last criteria under, so the last symptom under criteria A is recurrent thought of death. So it may associated with recurrent suicidal ideation without a specific plan or a suicide attempt, which is very common for a depressed person, or a specific plan for committing suicide. So a depressed person may wish not to be burden to other people. Moving forward to the next criteria, which is criteria B, the symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So when we say distress, they experience extreme sorrow, extreme anxiety, or pain, while impairment is losing the ability to function in social and occupational activities. So that's it. While criteria C is when the episode is not attributable or should not be should not caused by physiological effects of a substance or to another medical condition. Criteria D, the occurrence of the major depressive disorder is not better explained by psychotic disorder, for example, schizophrenia. And the last criteria is there has never been a manic episode or hypomanic episode. When we say when we say a manic episode, it is the period of abnormally elevated extreme changes in mood, behavior, and activity and energy level. While hypomanic episode is just a milder form of manic episode. So that are the signs and symptoms of a major depressive disorder.
Wow, thank you very much for that wonderful information from Miss Margaret. And for those people who are asking if there are people who are depressed, well, they are not technically okay. So don't say them that you can bear with it, you can handle it, because they need to get treated according to the panelists we discussed. All right. So yeah, before we proceed, I would just like to present some case study to you guys, and I will read it, and I will going to ask you a follow-up question regarding the story. Okay, so it's actually the summary of the case study, which it is from Carlos. It's a real life situation. Now, in our case study, it was said here that Carlos was born in 1975 in Philadelphia, Pennsylvania. His parents were both born in Puerto Rico and was trained there as a plumber. And by the time as Carlos graduated from high school and began working in the family business full time, it was a solid company that sold supplies to plumbers, builders, and contractors in several states. Carlos got engaged to Sonia 2 years after graduating in high school. He was 22 years old when he got married to Sonia and have 4 children. Now, however, there was a sudden decline happened to Carlos because of the loss of his cousin. Carlos was heartbroken over the death of his cousin, who died of a heart attack. He started to worry about himself, that he might also have a heart condition, and because of what happened, he is in deep grief and frequently sobs with Sonia. He went to see his cardiologist, who told him that, well, you're just perfectly fine. But Carlos still sheds a tear, and the doctor said that there's something wrong with this person. She decided to refer to him to a psychologist and a psychiatrist. A psychologist told him that he had depression and insisted on psychological treatment and some antidepressant medication. And upon hearing that, Carlos felt the desperation and poor concentration at work that he had a mental illness because his sister had a mental illness also before. He went to see a psychiatrist and started doing on medication. The doctor insisted Carlos undergo psychotherapy, but then he refused. He tried different types of antidepressant, but Carlos remained depressed. He had anxiety that he might have a nervous breakdown. He was even hospitalized and released after 3 weeks, but then he started to feel better. But then when fall arrived, his depression returned again. He started being hopeless and unmotivated to work, and he even tells Sonia that he can't manage the chores and the children anymore. So it's a very, very tough a case study from Carlos, and it actually affects his living, right? Do you agree with that? And the depression really, really affected his life and his role as a father to his family, right? So my question coming from you, Miss Samantha, since you said earlier that there was some study show that genetics can affect an individual. So my question to you is that was it a combination of genetics and environment that caused Carlos's major depressive disorder?
Thank you. Actually, yes. In the case of Carlos, it was actually a combination of genetics and environmental factors. In part of genetic, it was already stated that Carlos' older sisters suffer from mental illness. It means that they are biological pre-exposed to mental illness or depression, to be exact, or to be specific, or they have highly vulnerable to mental illnesses. According to the study, a first-degree family member of an individual with MDD have risk of MDD two or fourfold higher than the rest of the population. It is with approximately heritability of 40%. While in terms of environmental factor, Carlos is exposed to the stressful life events in his family and his work environment. Example, his cousin passed away because of heart attack and other work-related events. Because of those stressful life events in his life, Carlos become hypersensitive. He had cognitive distortion and catastrophic visualization that led him to to develop a major depressive disorder.
Yeah, well, so it's actually a combination, right? Well, thank you for that. And also I have a follow-up question. It's actually from Miss Jewels. So what are efforts underway to improve the treatment for depression?
Okay, thank you for that question. So in the case of Carlos, who has a major depressive disorder, the efforts underway to improve the treatment of depression when he's sick, the psychologist recommend that he needs to consult with a psychiatric specialist to advise him on the benefits of the antidepressant. So then the psychiatrist explained that taking the medication and undergoing psychotherapy at the same time will be great and will be very helpful for him. So yet he decided to go on medication alone during that time. But Carlos keeps switching between the different medication due to different side effects. So the psychiatrist tells him that it is best to hospitalize than various combination of medication can try. And after that, one successful combination provided some relief to him. So Carlos was discharged from the hospital with the plan of continuing to see his psychiatrist once a week for the session. So that is where the underway to the improvement of the treatment of depression of Carlos.
All right, thank you for that. Also have a follow-up questions with Miss Margaret. Since earlier you said about the signs and symptoms of a depressive person, right? So what factors had the most impact for you on triggering Carlos's depression?
So what triggered Carlos the most was the death of his cousin, because according to the Diagnostic and Statistical Manual of Mental Disorders, or this DSM-5 by American Psychiatric Association, responses to significant loss like bereavement may resemble a depressive episode. So due to his loss, it triggered his depressed mood and loss of interest, which is present in criteria A, that was discussed, that I discussed earlier. And also he started excessively worrying about getting a heart condition like his cousin. So this occurrence triggered the MDD episodes of Carlos, which have progressed as time goes by.
All right, thank you for that. Your claims are very provided with your discussion earlier, right? So thank you for that. Last question, actually from Miss Diane. Okay. What is the final solution of the doctor to Carlos's disorder?
For Carlos, the best or the final decision his psychiatrist and psychologist came up with is the combination of the two medication, which is the pharmacotherapy and psychotherapy. So Carlos had undergo the session of psychotherapy under cognitive therapy, and he had also the pharmacotherapy under the surveillance of his doctor, which is Dr. Su, or his psychiatrist. So he had take Prozac, the medication, as his antidepressant. So the two work hand in hand for his final medication.
All right, right. That's actually true, right? And the main reason why Carlos is still undergoing depression because he refused to go psychotherapy, which technically is a wrong idea. Okay, so yeah, moving on. Thank you for that wonderful answers, panelists. Before we proceed with the preventions, right? And what are the treatments? Can I ask someone who wants to discuss what are the treatments for a depressive person or someone who has a depression? Actually, yeah. Panelists, go ahead.
Well, actually, for treatments, there are very different types of treatments a person with depression could undergo. But for this topic that we are going to focus on the MDD, major depressive disorder. So I'll be discussing some of the treatments advised by Anxiety and Depression Association of America, wherein their advice was relied on the DSM-5. So starting with the pharmacotherapy. Okay, so for pharmacotherapy, this treatment is given by a psychiatrist. However, this kind of treatment will be categorized according to the age level. You are not going to be given medication just according, you just wanted to have that medication. No, it's not like that. You will be categorized according to your age level. So let's start with the adults, starting with SSRIs. SSRI stands for selective serotonin reuptake inhibitors. When you say reuptake inhibitors, this is a medication that will help increase the concentration of your brain chemicals to be highlighted by the serotonin, the positive hormones, for you to alter a good mood or the mood of having a balanced mood for you to use in the daily basis. So here on the first one, SSRIs, from the word itself, serotonin. So the medication or the treatments, antidepressant used is mainly focused on the serotonin itself. So the second one is the SNRIs, or the serotonin and norepinephrine reuptake inhibitors. So this medication or this type of antidepressant will be given to those person who is or having a lack in terms of their serotonin and norepinephrine. So in this one, merely the side effects is somehow disturbing because the person will be suffering insomnia and the change in his or her sexual function. So based on the listed here, these are the list of some SNRIs a person could take, such as diloxetine, and just to mention a few. So these are the type of antidepressant that includes serotonin and norepinephrine. So the last one is the TCAs, or tricyclic antidepressant. This is given to those person who mostly needed a high level of norepinephrine compared to serotonin. However, this type of antidepressant has a combination of the two. It is just that it has mainly highlighted the norepinephrine. So for the children and adolescents, this type of antidepressant that is given to them based on their diagnosis from his or her psychiatrist, mostly the given antidepressant is the serotonin. So these are the listed antidepressant given to them. The fluoxetine, SSRIs, the sertraline, just to name a few. So those are the pharmacotherapy given to those people diagnosed by MDD by their psychiatrist. So another medication or treatment given to a person diagnosed by MDD is psychotherapy. This is supervised by a psychologist. So there are different types of treatments or therapy given to a person with MDD, but it will be only given if his or her diagnosis is severe type of MDD that is with different levels or treatment needed. So starting with the cognitive therapy wherein Carlos had undergo, which is he was overpowered by his thoughts. So what the psychologist will do, they will he will change that negative thought into a positive one. Different type, he will transition that point of view into a positive one. So the next one is the cognitive behavioral therapy, CBT. This is the type of a person wherein his or her behavior is merely negative. So what will the psychologist do is to unleash different types of ways or response for her behavior. Next one is the interpersonal psychotherapy. This is this type of treatment is given to a person who's having a hard time dealing with communicating with others. So what will the psychologist do is to unleash or give him the skills, techniques he need to develop during the session for him to improve his communication skills. Next one is the problem-solving therapy. This is the type of therapy given to a person who's having a hard time on providing rational solutions, rational solving problem skills. So what will that psychologist do is to develop the holistic and rational type of solution during the session. So next one is the behavioral therapy or the BT. This is given to a person who's having a hard time dealing his behavior that affects his emotions. So what will the psychologist do is improve that type of behavior of him, acknowledge that behavior, and improve that one that would affect his emotion in positive way. So the next one is psychodynamic therapy. This one is to be given to those person who had having a hard time acknowledging their emotion, acknowledging their unconscious behavior. So what will the psychologist do is for them to develop deep understanding and to hasten their understanding that that certain emotion they are feeling is normal. So the next one is the social skills training. This one is given to those person who's having a hard time to socialize herself in a social setting. So the psychologist will give a type of treatment or a session. During the session, he will practice him or her to give techniques on how will he or she will deal with the social setting. So the very last one is the dialectal behavior therapy. This is given to a person who's having a hard time accepting his thoughts and behavior. This is quite different from psychodynamic therapy, because psychodynamic therapy is to understand, and this one to dialect behavioral therapy is to acknowledge that your feelings and emotion is normal to deal with. So those are the psychotherapy given by a psychologist for a person diagnosed with MDD. So the next one is a treatment. What if your patient cannot respond to those type of treatment? So we have here, the first one is given for adult, the ECT. This is very known. However, before there was an stigma that it is somehow dangerous. However, on a innovative innovative situation we have right now, it was already given general anesthesia for a person that would undergo ECT. When we say ECT, it is electroconvulsive therapy. So this therapy, the patient will undergo a treatment that involves sending an electric current through her brain, wherein the brain will be undergoing seizure, triggering the neurotransmitter, possibly the positive ones, for him to have. So it would last for about 5 to 10 minutes, 3 times a week, and would last for about 8 to 12 sessions depending on the recommendation of your psychologist. So the next one is for the children and adolescents. For example, if the children or adolescent taking up an antidepressant wherein that antidepressant didn't work for him or her, what will the psychiatrist do is to change the initial antidepressant into a more effective one wherein it has that will hasten the neurotransmitter that will give him the type of neurotransmitter that will help his neurotransmitter become stronger. So the next one is if the first or the initial psychotherapy given it did not work, the psychologist would suggest another one that would help the patient herself. So there are also natural treatments given if that person could not attain or did not have enough money to undergo that kind of treatment. We have natural treatments. Probably this mainly focus on the food that we eat. So the food that we eat must have amino acids because when we are lacking with amino acids, tendency it affects the regulation of our hormones. So if our hormones is effective, probably our emotion as well. So it's starting with the omega-3 and then this what we call SAM-E or adenosyl methanoid. This is the type of chemical present in an amino acid. So those are the treatments a person diagnosed with MDD can take on. However, we must remember that if you saw some signs given by our panelists, do not ever diagnose if you had some dose, but instead consult a registered or doctor, a practitioner that will help you become better. So that's all. Thank you.
All right, thank you for that. All right, thank you for that wonderful answer. So if you are a depressed individual, again, do not hesitate to ask for help. Get treated immediately and consult to your physician or to your psychiatrist. There are a lot of possible outcomes, okay? So I have a follow-up question also, last question from Miss Jewels. As you said earlier, the improvements on how to treat the depression. So a follow-up question, can depression be prevented? Ms. Jewels?
Okay, so thank you for that question. So yeah, so we can actually prevent depression in some cases. So next slide, please. So first, we have to exercise regularly. So how does exercise help depression? First, the reason is it helps to release the feel-good endorphins. It is our natural brain chemicals that can enhance the sense of well-being. But before starting a new exercise program, the person needs to check with a doctor to talk to figure out which physical activities that is suitable and appropriate for that patient. So because it is a case-to-case basis, especially if the patient have a present illness or previous health issues. So second is the cut back on social media time. So according to PubMed Central, research has shown that increase of social media usage can contribute to the depression. The reason is it is the different social media sites can highly influence individual on negative side, and it can be a trigger for them. So of course, because some people social media is a part of the daily routine, it's a habit, okay, and it is necessity for communication. So nowadays some people call it a social media detox. They're deactivating their all social media accounts, so the individual can plan and schedule the time in accessing and checking it, only going to social media with a purpose. So next slide, please. So next is build strong relationships. So it is critical for our mental health to have a strong support and active social life. So according to research, even sufficient or adequate social support can protect against depression. So yes, having healthy relationship is a great way to ease the symptoms of depression. It is not all about romantic relationship. It is the connection between families, friends, something like that. Okay, having a person or friends that will listen, understand on what you're going through in your life is very important. So, but the catch is, yeah, you need to choose a person or friends very wisely, because nowadays trusting is so challenging and you cannot trust anyone. And then get plenty of sleep. Okay, get plenty of sleep. According to National Sleep Foundation guidelines, for teenagers, 8 to 10 hours, and for adults, it is 7 to 9 hours recommended hours of sleep. And a good night's sleep is essential for both mental and physical health. So, how you will get a better sleep? So, first, you can avoid using gadgets, specifically cell phone, 30 minutes before going to bed. Of course, avoid coffee and anything that contains caffeine before you go to bed, because caffeine is a stimulant that is can make hard for you to fall asleep. So um, next is the eat well. So maintaining good nutrition and eating healthy is help to prevent depression. So the body needs essential nutrients required for physical and mental health. So to prevent depression, you need to control your diet, reducing high sugar, high fatty acids, eat balanced diet with protein, vegetables, fruits, like that. So and as much as possible, eliminate processed foods from your diet. So next is read prescription medication side effects carefully. So however, depression can be side effect of a variety of prescription medication. Before taking prescription, please carefully read the label. So yeah, so because a few medication that can cause depression included the hormonal medication like birth control pills, okay, the anticonvulsants, corticosteroid, beta blockers, and many more. And then the last one is reduce stress. Okay, next slide, please. So, learning to manage and cope with stress is essential for good mental health. So, how we will reduce the stress. So, first, avoid committing too many things. Yeah, sometimes a person become overwhelmed in many things, and they tend to forget to take a break, to take a pause or stop. That thing might then trigger. And yes, I think that is the prevention. But before I end this, I just want to say that if the person did all the different preventions, but depression symptoms still interfere with his or her daily life, daily living, the person need to see a doctor or mental health professional, because the preventions are indeed, there are the great ways to ease the symptoms of depression, but they aren't a substitute for psychotherapy or medication. And that's all for the prevention.
Wow. Okay, let's give a round of applause to our panelists for today. Wow, very good job, guys. Very informative. It was indeed that the discussion played very well on how you can actually conceptualize depression, the genetics, and what are the other treatments and the prevention. So before we end our discussion, I would just like to share this quotation with you, saying that recovery is not one and done. It is a lifelong journey that takes place one day, one step at a time. And if you are an individual who is experiencing depression, remember that everything is a process, and appreciate every process, convert it into progress that will serve as development from your mental progression. Okay? All right. So again, thank you guys for staying here for a very productive discussion. Again, I would like to formally introduce myself before we end our discussion. Again, I am your moderator for today. I am Niko S Dolar, and let's give a round of applause for our panelists for today. This is Samantha, Miss Jewels, Miss Margaret, and Miss Christine Diane. So thank you guys. Thank you for listening to our panel discussion.